If knee pain is stopping you from walking or sleeping, robotic knee replacement may have come up as an option. It is a knee replacement, where a computer-assisted system helps the surgeon plan and perform the operation with added precision. The worn cartilage and bone surfaces of the knee are replaced with metal and plastic components that let the joint move smoothly. The most common reason is osteoarthritis, but rheumatoid arthritis, past injury, or bone damage can also wear the joint down. Surgeons typically consider it when pain limits daily life despite trying physiotherapy, medication, weight management, or injections. Before surgery, a CT scan or in-theater mapping builds a 3D model of your knee so the surgeon can plan every cut. During surgery, a robotic arm or handheld tool guides the cutting instruments along the planned path, limiting them to the intended area. The surgeon plans, cuts, and places every implant. The robotic system provides live data on alignment and ligament balance. Metal components are fixed to the bone with cement, and a plastic spacer forms the new smooth joint surface. Most patients stay in hospital 2 to 4 days and are helped to take their first steps within 24 hours. By 4 to 6 weeks, many patients walk indoors without aids. Strength and comfort keep improving over 6 to 12 months. Physiotherapy is central. Consistent exercises rebuild the quadriceps, restore bending and straightening, and shape the final result. Risks include infection, blood clots, stiffness, or implant wear over time. Serious complications are uncommon, but worth discussing. Published data show most modern knee implants still function well 15 to 20 years after surgery, with many lasting longer. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.